So let's try to look at this from our patient's perspective. I have a dental appointment tomorrow. Didn't sleep well last night. I woke up this morning with a pit in my stomach. When I arrive at my dentist's office, my palms are sweating, my heart is racing. When I actually get in the dental chair, I just want to run away. I just want to escape. I felt this way since I was a child. Feel like I have no control over this behavior. Our childhood dentist would give us the most painful shots and then start drilling immediately. When we used to have our morning huddles, the staff and I around the table looking at the schedule, we would gasp, grimace, and groan when we would see Barb or Joe on the schedule. All we wanted to do was to get past Barb or Joe and hope that tomorrow will be a better day. I didn't care how much time we gave up because I set aside extra time. I didn't care about my daily production. I just wanted to get past those patients. After 28 years of this, I was getting chewed up and spit out on an almost daily basis. I went through a bad period myself after about 10 years of practice. Yep, I was getting busier. Yep, I was seeing more patients, being more productive. I was getting well established, but at a terrible cost to myself and my family. My response, honestly, was to come home at the end of the day and have a shot and a beer, strictly to blunt the pain from the day. My ex-wife looked worried, the kids looked worried. I wasn't proud of my behavior at all. I just wanted to blunt the pain from the course of the day. I mean, since I was 13 years old, all I ever wanted to be was a dentist. I got to dental school, and I was so pumped up to go out and start treating my patients' mouths and taking care of their teeth. The problem was, as I got busier and busier, I came across more and more of these darn anxious patients. They actually became the silent killers of my energy, of my soul, of my zeal for dentistry. After 15 years of this, I was feeling trapped. I was getting depressed. It was kind of a vicious cycle. I wasn't sure what to do. Every day just seemed like I could no longer see the light at the end of the tunnel. It was not a good feeling. I was busy, but I was depressed. Thank God my survival instincts kicked in. I got some therapy, I got back in the pool, I started working out. It was like something out of a Rocky movie where I would get hit down by those anxious patients, but now I was fighting back. I was physically and emotionally training myself on a daily basis to deal with the minefield of anxious patients that were waiting for me at my dental office. I was succeeding, but that success had a serious price, and I had to physically train every single day to stay on top of it. That's how hard it was.